Hello everyone, my name is Tara Sorabi. I'm a nursing faculty, full-time faculty in nursing program and teaching a second semester which is health and maintenance of adult. We call it medical surgical number 1, and we have challenges in our program across the whole program, and I'm gonna just name 2 of them based on the UDL Capstone that is asking us to do, and I hope I could be able to explain as enough as possible. So I have a little introduction about the barriers that I want to talk. So today, considering the change in learning needs, changes of the pattern of the disease, and increase of the care that is needed, and the shortage of the nurses, and also the high cost in nursing program and medical education. On the other hand, the importance of caring for proper clinical education has been multiplied. Proper clinical education alongside the theory is one of the most important part of education in nursing, which in the care behavior of nurses are formed. Also, the objective of nursing, which is providing proper high quality care, is realized through this. A clinical practice is considered an opportunity for learning skills by the nurses, which, unlike theory in the classes, it is very complex, context-packed with challenges in different dimensions. A proper educational setting in clinical practice is one of the very important factors in the learning of a student and nurse provide quality care to the patient. So it's very important to understand the clinical parts as they learn the theory. So I'm going to discuss 2 barriers in nursing education. So the first question in our rubric is instructional barrier to be addressed. So what are my students struggling with? So basically, a nursing student struggle in many areas, and each semester some of those areas is supported by the faculty to improve their knowledge and prepare them for the upcoming semester. What I, as a full-time faculty, just noticed in our student is comprehension of the content and also the lack of the clinical practice. Comprehension usually it is vary within the student, so not every single student has the same problem. It depends on the background of the education and what type of education and from which country they have learned. So it depends on variety factors in their background. And also the clinical practice, also if we could have more hours in a specific units in the hospital that they learn the theory at the same time and practice with the same type of patient, it could be easier for them to comprehend. I give an example, maybe it makes it easier for you guys that are not in the nursing field. For example, if we teach a fracture to a student and we take the student to a unit that has Alzheimer, they will never learn about caring a patient with a fracture. Or if we teach them patient stroke or brain damage and we take them to the unit that has diabetes, they cannot practice properly. Yes, diabetes also can cause a stroke, is one of the complications, but basically the proper practice makes them understanding the disease and disease process and how to take care of them. Basically, this is not only our program difficulties. Many programs in the nationwide are having the same difficulty because more hospitals are getting so difficult to let the student practice in many areas in the hospital or in hospital at all. So detailed strategy or method that I would use for barrier 1, I found good checkpoints. So for the first barrier, which was the understanding the content, how might I use the checkpoint to meet the needs of my learners? I'm going to use the checkpoint 8.2, which is very demands and resources to optimize challenges. So basically I chose 2 of them, but there are many more points that I could use to help my learner to understand the checkpoints better. So learners vary not only in their skills and abilities, but also in the kind of challenges that motivate them to do their best work. Well, all learners need to be challenged, but not always in the same way. So in addition to provide appropriately varied levels and type of demands, learners also need to be provided with the right kind of resources that is necessary for their success and completion of the task or the program that they are in there. Usually the learner cannot meet the demand without appropriate and flexible resources. Providing a range of demand and range of possible resources allow them to find challenges that are optimally motivating. Balancing the resources available to meet the challenge is vital. Breaking the concepts to smaller and more simple pieces for a student to understand is very important, and this could be done by using case studies to improve the critical thinking. I really like to use case study during each lecture, and also in our clinical day we break down each patient as a case and go over many areas like the sign and symptom of the disease, pathophysiology, using the case study, teaching a student the safe practice and care that should be done for the first day, second day, or ongoing day that the patient is in the hospital. So for what brings this principle or checkpoint to life? Well, we need to foster a collaboration and community. We need to create a cooperative learning group, create positive behavior support to differentiate objectives of the content and support the student, provide prompts that guide learners in when and how to ask from their peers, from the teacher for help, and encourage them to interact with their peers, and by using like rubrics or guidelines, create expectation for group work. So because I have two barriers, it should be two barriers. For the barriers number 2, I would like use physical action, like using the providing learners with the tools that are, and we need to provide the support. So we need to optimize their access to the tools and assistive technology, but we must provide them with the support, because not every single student is able to navigate with those technologies. So basically they need support from the peers and faculty and teachers. Well, in nursing, what we do for barrier 2, we provided the student with the VSIM, which is the virtual simulation, and the student learn from the virtual simulation. Right now, as the VSIM is used as a virtual simulation instead of taking the student to the hospital, because right now hospital don't allow the student practice in the hospital because of the COVID-19. So we have been using the VSIM before as an alternative, but now VSIMs are the actual clinical, but that fosters their clinical practice and improves their critical thinking, but they still have lack of hands-on skills, which the school is just planning for the 4th semester student to practice more skills in the lab for fall 20. Okay, and let's talk about the principles or checkpoints. I think I went over the support, and we need to provide support to the learners to navigate different technology. What the method or the strategies looks like in the context. Multiple representation should be used to allow students to make connection within as well as between the concepts. Providing different options for presentation is essential. How I do that, I post the PowerPoint, and then the same as I'm doing right now, voicing over the PowerPoint, and providing the link from the YouTube for the student, and asking them to prepare themselves before, and then I also present some case studies in the same way with the voice over the PowerPoint, and we go over the case studies during the lecture to improve the student critical thinking. So we use different, or I should say, I use different strategies for this purpose. So the last question in the rubric is asking, what does successful implementation look like? Basically, if the student don't understand or comprehend the content, the first assessment, which is the test, shows lower grade. So basically, this using a successful implementation, the first data that we have is the test result. So if the test results are higher, that means we were successful in teaching the concepts and making sure the student understand and comprehend the concepts. And also we have different tools, or I would say different workout or homework for the student, that they should create a plan of care for a patient. And if the student does not understand or comprehend a disease, it would be very difficult for them to create a plan of care for that patient for each day of in the clinical. So basically, reading their care plan or plan of care for a patient with a disease or a multiple disease, it will show us that the strategy that we were using were successful, and the student understood how to take care of the patient. How did the principle or checkpoint enhance my student outcome? Well, we've been using it most of the time, but it's not consistent. And in the program, I believe if we could be consistent in the whole program, nursing program, I mean, we could be more successful doing this. And I hope in the future more faculty from the nursing join to the UDL and learn how to use universal design learning and all these resources that we were able to access, they could access and use it, and go through this for the student success. Well, it was a great opportunity learning from this course, and I would end my PowerPoint and hope that you enjoyed this as well.